Yeah. Sheesh. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da, 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da, 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da, 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da, 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 da. celebrate. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. Okay. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. Okay. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. Oh, yeah, yeah. Oh. Slide this way, vibe this way, shine this way, grind a way. I said shine this way, I said shine away, shine this way, I said, okay, okay, do like this, who like this, you like this, okay, you like this, who like this, da, who like this, move like this, yeah. I don't need no time for this, I'm just gonna vibe with this, I think I like this, so I'ma take my time with this, I said I'm gonna take my time with this, grind with this, shine with this, vibe with this, time with this, move like this, I said move like this, shine like this, grind like this, time like this, I said vibe like this, I like this, oh, I like this, oh, move like this, shine like this, I said shine like this, grind like this, time like this, I like this, I said I like this, I like this, I said I like this, I said I like this, oh, I go move for you, okay. I said I said Ay, ay, ay. I said, ay, ay, ay. Ay, ay, ay. Ay, ay, ay. Sheesh. Yeah. Oh, yeah. Da 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 da. Yeah. Sheesh. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da.
Okay. Hello, everyone. Dr. Uche, I think we are on.
Good evening, Prof, and good evening, everyone.
Good evening, everyone. So, first of all, good evening, everyone, and welcome to the very first edition of the NCCP Thursday Live. Okay, Dr. Uche, what do you think? We didn't know whether this was going to happen, but it's happening. What do you think?
It's actually very exciting that finally it's happening and happening live. And we're here to keep Nigerians and the whole world updated on the efforts of the TWG led by our dynamic chair who has kept the tempo ongoing. So we are glad to have everyone here.
Okay, absolutely. And it's such a great thing to walk beside you, Dr. Uche. You really have been one of the hardest working uh, persons that I ever do. So this is great. So officially, on behalf of the National Cancer Control Plan Technical Working Group, thank you for joining us this evening. Before we even start a celebration, I want to join you along with Dr. Uche as well as all the other technical working group members to say happy Cancer Survivors Awareness Month. We recognize survivors as essential partners in cancer control. Their lived experiences help guide our efforts to build a more compassionate, equitable, and effective cancer care system for all of us. So, happy Cancer Survivors Awareness Month. So, with me today is Dr. Uche Nwoko, and we are going to introduce ourselves, but I'm going to start with Dr. Uche first. We fondly call him Dr. Uche. So, do you want to introduce yourself first, Dr. Uche?
Thank you, my capacity chair. My name is Dr. Uche Chukwu Emmanuel Moku. I am a Deputy Director and the National Coordinator, National Cancer Control Program, Freedoms of Health and Social Welfare, and the Secretary of the NCCP Technical Working Group, supporting at the secretariat level, supporting my chair and the co-chair, Professor Fadake Modedino and Professor Usman Malami Abiyu. Um, so I work at the secretariat to coordinate the affairs of the TWG. Thank you so much.
Awesome. Okay, thank you, Dr. Uche. And I'm Professor Fulakemi Odedino, and I am really humbled to say that I am the chair of our technical working group and really so delighted to be working with quite an impressive and exceptional group of technical working group members within Nigeria and outside Nigeria. So tonight is a very special evening because we are launching what we hope will become an important national platform, maybe even a global platform for learning, engagement, collaboration, and public awareness around cancer control. The theme for tonight's conversation is Inside the NCCP, Why This Movement Matters. And we have a lot that is packed that we are going to be discussing, including what the NCCP is, why the technical working group was established, what we are trying to accomplish, why implementation matters, and how every Nigeria can become part of this movement. So before we bring the rest of the panel in, I actually want Dr. Uwoko to answer some questions. So are you ready for my question, Dr. Uwoko?
Yes, Prof.
Okay, so I'm going to answer maybe a couple of questions. One is, what exactly is the National Cancer Control Plan? And why is it so important for Nigeria at this moment?
Thank you, Prof, for that question. The National Cancer Control Plan um, is just a strategy, the document produced by Nigerian governments, by the federal government of Nigeria, through the Federal Ministry of Health, outlining what Nigeria intends to do within the period of 5 years, 2026 to 2030, to address cancer care burden in Nigeria with the target of reducing Nigerian cancer burden by 50% within 5 years. That's a very ambitious plan because if you understand where we are right now, then by 50% is actually very ambitious. But we are very optimistic that with the right political will, with the right set of people driving the plan, it is achievable. So when the government looked at how are we going to implement this plan to actualize this ambitious plan, we felt that it is important to look globally and look for those whom we think have the capacity to drive implementation. So that means the country has actually placed on the shoulders of this TWG a very um, mighty job of trying to reverse what the country has not been able to do over a period of for a very long time now, within 5 years. So if we look at the burden of cancer in Nigeria, is actually enormous with limited infrastructure, with uh, very poor numbers of various specialists in various oncology specialties, from radiation oncologists to the radiotherapists to oncology pharmacists to oncology nurses to psycho-oncologists to virtually everyone that is needed to provide cancer care in the country. We have gross limited numbers of that. Okay, so and then if we look at the diagnostics from risk assessment to screening to early detection to diagnosis to treatment to even end of life care, we need quite a number of resources, human and material, to be able to get this actualized. So this plan has been able to outline in specific terms objectives, strategies, and activities to be able to ensure that all of these are actualized within a period of 5 years. And that's why the plan was divided into 8 pillars. So each of those pillars have specific activities as it to be implemented within each of the years for the entire 5 years. And then the plan was also costed, so we have an idea of the total amount of money required to implement this plan. So we are hoping that the government and the TWG and every other stakeholder will be able to work together to ensure that we're able to raise the resources to provide the required trainings, provide the required infrastructure, and of course, within the period, measure the impacts of the implementation. So it's quite ambitious, but we're hoping that we've got on our side and the support of our experts who have been gathered in the village of the TWG will be able to achieve this.
Thank you so much, Dr. Woko. That was actually a very, very broad explanation of what the NCCP will. I have one more question for you, and then I'll see whether you have any questions for me. As you know, there are so many cancer plans that are developed but never fully implemented. This is not the first time that multiple countries have this ambitious goal of cancer control through the NCCP. What do you think will make this one different compared to the others or other countries that have not been able to do this?
Yeah, thank you, Prof. I will share my experience as a national coordinator. We are opportuned to have conversations during different conferences and meetings across the globe with other countries' national coordinators. Okay, so even in 2025, we were in Geneva where we had Cancer Planners Forum organized by the UICC, and we shared ideas about cancer control plans across the globe. And we were able to share our experience in the country. And coming back from that meeting, it dawned on me that we needed to review our own national plan to be in tune with the current reality globally. So that informed our decision to review the plan and have our current plan. So even Nigeria has had previous national cancer control plans. We had the plan for 2007 to 2013. We had 2018 to 2022 before we have this 2026 to 2030. And we had also struggled, we have in the past struggled to implement those plans. Okay, but when we were in Geneva, so I looked at some of the shortcomings of other countries, and then of course reflected, having been part of our own implementation in the last 15 years to 16 years. I also looked at what were those setbacks that made us not be able to implement our plans. And what came very prominently was the fact that we needed people, the right people to drive it. So government may be able to develop a plan, support it, fund it to an extent, but if we don't have the right people to implement it, then that implementation will not be done properly. So even the resources that is deployed to implement will be wasted. Okay, so and that was why the first thing the Honourable Minister did was to set up the TWG. And yes, I also agree that we have had TWG in the past, but of course, having been part of that TWG, I also know that we needed to do it differently and have the right people with the right mindsets, okay, people who are a bit selfless in what they do, and those who have also excelled in their various endeavors. If we have those people driving this, then we were optimistic that we're going to have a different implementation strategy. And that was why the Honourable Minister looked out for selfless, capacity reading people to be able to drive. So we're hoping that this is going to be the change. Unfortunately, I must confess, fortunately, from the date, in fact, even before the inauguration, the TWG had already started working.
Yes.
And of course, the tempo has been quite monumental and very, very commendable. So even from the Federal Ministry of Health, we're even struggling to cope with the kind of pressure we're getting from the TWG. Of course, the right pressure, the positive pressure. So we're hoping that this kind of pressure, once sustained, will definitely make this plan implementation much easier than anticipated.
Yeah, I definitely agree with you on that. So it would not be fair if I ask you questions and you don't get to ask me questions. So maybe you ask me one question, Dr. Uche.
Yes, thank you, my chair. So my first question to you is what exactly is the NCCP, the National Cancer Control Plan, and why is it so important for Nigeria at this moment?
Okay, yeah, great question.
Yes.
Yes. So for me, the way that I see the NCCP is kind of like a roadmap. I always think to myself in everything that I do, whether I'm doing my research or I'm doing any activities that I do, I think that where is the roadmap? It's like coming out of my house and I'm going to a place. I need to know the destination that I'm going, and I need to know in my head, use a Google map, use an actual map, or use my memory of where that I'm going to. So I do see the NCCP as the roadmap. The beauty is, I think sometimes people have a roadmap, but they do not have their destination in mind. Where exactly? But one thing that I love about this current NCCP, which you have put so well, is that we have the destination, we know where we're going. Another thing that I love about this NCCP is the use of implementation science to translate our plans into action. And this is why I think the Nigerian model at this time is going to be a global model. Implementation science will help us to understand what is working, for whom is it working for, and under what circumstances is it working. And that would allow us to move beyond planning, which is not, the only thing we want to do, but we want to ensure the implementation of evidence-based approaches that are very effective, that can be effectively adopted, scaled, as well as planned. So I'm really, truly excited about the leadership that has been put together, and we're going to be meeting some of those leaders right now. I'm looking at the time. One thing that becomes very clear is that plans do not change the outcomes, but implementation does. So this is exactly why this movement really exists. I think the number one person that we are bringing now is Chief Mrs. Makonjola. So do we have Mrs. Makonjola on?
Yes, I'm here. A very exciting evening. Good evening, our dynamic chair. And I call him 24 hours doctor on call, Dr. Uche. It's also good to see you. And good evening from wherever you're watching us.
So the first thing is that, can you please introduce yourself and your role within the TWG Chief Makojola, and then I will hand it over to Dr. Nwoku to ask you the questions that need to be asked.
All right. Yes, my name, like my chair has said, I'm Muji Makojola. She prefers me to add the chief. Right. Having said that, I lead the International Society of Media in Public Health. And what we do is make media a strategic tool for control, prevention, treatment, policy analysis of health sector in Nigeria. That I founded about 15 years on, and we've been on, and we've been strategically placed in all efforts by both public and private to improve healthcare delivery service in Nigeria, and making the media a strategic tool for use going forward, considering the fact that we're still in a country where we have loads of misinformation about health intervention. We have also quite a number of things. So a lot of things we're doing in the media and comms space, documentaries, public texts, for better understanding, radio, TV, and of course the newspaper, and very recently too, using technology maximally, that is online information dissemination, that goes a long way to dissuade the belief that about concerning the I would say the misery around cancers, and we have done this successfully. I'm an advocate. I'm a member of the National Task Force on Cervical Cancer Elimination in Nigeria, and I am also a health correspondent myself, having worked on television for about 4 decades going now. Still not tired, until of course we reach the promised land where we can eliminate cancers in Nigeria. Thank you. That's Muji.
Yes. Thank you. Over to you, Dr. Uche. Do you want to ask? Do you have specific questions you want to ask? Are you muted? Okay, great.
Yes, thank you so much, Auntie Moji. I want to know, how can journalists, communicators, and influencers support the NCCP movement?
Fantastic. That's a good question, which I would like to, should I say, like to very much delve into. It's important for us to understand that the media is crucial because it helps to educate, inform, and influence public attitudes and behaviors. And we need that concerning cancer controls in all its ramifications. So what are we going to be doing? Why is it important? It's important for us because we're still in an environment. We need to understand our environment where misinformation, traditional and cultural barriers still stands at huge gaps when you think of disease control, particularly that of cancer. So we are an important tool, that is communication, effective communication, deliberate communication that will push forward health education and information that will help people to understand. Take, for example, we're looking at HPV vaccines. There were a lot of skepticism about it. The media was able to put that aside, and we're still working at it. We're not there yet, but we have become the tool to visit. People would ask questions. They in fact infer that, would you allow your child to be vaccinated, for example? And the media is out there. We go so in our own space here in Nigeria, you find yourself that you go a little bit out of work. I mean, you go beyond the call of duty, but also ensuring ethical practice as we go on. So we'll be promoting preservation, encouraging early detection and screening. And Dr. Uche, I've worked with you on that. We're still doing that now as we march towards EMO, and other things that we're doing. Well, and of course, to reduce stigma. We have been to the field as health correspondents. We have a media cell. The media cell is, it was formed to actually help to improve the information dissemination of cancers in Nigeria. So, and in doing that, we'll be able to reduce stigma. We'll be supporting, ensure that we support patients and families especially that we have a lot of them who are vulnerable, can't pay out of pocket as it is, and helping to promote what government has in place. I mean, the functionality of the cancer funds, for example, and how people can get it. So, and also, being part and being a national voice and an advocate will go a long way. And policy influence, because we talk to the people. We are the eyes and the ears of the people. We're able to say to policymakers like Dr. Uche and the Honorable Minister and say, listen, we have this in place as a policy, but it's not going well with the generality of the people that it should be helping. So we're able to speak truth to power, so to speak. We are also there with you to raise funds, and I know that my chair is very strong on that we can have an in-country sustainability, financial sustainability, at some measure where we can reach out to particularly the poor and the vulnerable. So I would say here that the media is a powerful tool for education, for prevention, for right messaging, to break down, some of the technicalities, because the chairman, I mean, when you're introducing yourself, oncology, blah, 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 people, Nigerians need to understand. And a lot of things that we can do where treatment is available, where you can go for treatment, why you should prevent, not even seek for treatment. I think the media is a strategic tool in that direction. And of course, the comms as well.
Thank you so much, Chief Makojola. I think what you are seeing is the experience, the expertise, the knowledge, the chief coming out of Chief Makojola, very well wrapped up in telling us the role of media and cancer communications. Thank you so much. I think next Chief Makojola is going to be back at the end of the hour to answer more questions, but we are going to move quickly now to bring in Professor Ifeoma Okoye and Professor Rotimi if they are on. Thank you so much. So starting with Professor Ifeoma Okoye, can you please introduce yourself and your role in the TWG very briefly?
Okay. So I'm Ifeoma Okoye, Emeritus Professor of Radiation Medicine, University of Nigeria, and Director of the University of Nigeria Center of Excellence for Clinical Trials. For the TWG NCCP, the Geopolitical Zone Southeast Liaison, and I'm excited about that post, as well as being the co-chair of the Clinical Trial Innovation Hub. And that, again, is something that is going to really break the ice in cancer control.
Awesome. Professor Rotimi, do you want to introduce yourself? We can't hear you, Professor Rotimi. I think you might have a mic issue.
I will address that.
Okay, try it again.
Okay. Can you hear me now?
Yes, we can hear you now.
Oh, thank you very much, and good evening from Nigeria to everyone joining us and all friends of Nigeria from all over the world. I'm Solomon Rotimi. I'm a professor at Covenant University, Nigeria. My area of work is looking at those things within our gene and our body that can lead to cancer, or we can use to treat cancer more effectively. On the NCCP TWG, I'm the Southwest Nigeria liaison. So I coordinate the activities within the Southwest Nigeria, and I'm happy to be here. Thank you very much.
Outstanding. I think Dr. Uche is going to take the question for Professor Rotimi.
Mm-hmm. Thank you so much, Prof, for that introduction. So from the Southwest geopolitical zone, and of course for the last zone generally. So I want to know, or we want to know, why was the subcommittee structure created for the TWG? Why do you think the role of the zonal zones? What role are they expected to play?
Yeah, thank you very much, sir. So we're dealing with two levels of complexity. One, the complexity of the disease itself, which is cancer. Number two, the complexity of Nigeria itself, based on our diversity. And without understanding and bringing it to creating a structure within the TWG to really accommodate those two levels of uniqueness and complexity, we won't be able to address, the problem that we have at hand. So you take, for example, addressing cancer requires a lot of expertise. There's no way one human being will be able to be a butcher, a driver, and everything in one. You have to stick to one, and you have to know it very well. But we need all the expertise in it, to solve this, to address this problem. And so the TWG has been structured into subcommittee, patterns such that we have expertise within a particular field coming together to look at the particular pillar within the NCCP and come up with a framework that they can use to then, implement and achieve that, goal. And then once that is done and an implementation plan is created within that subcommittee, is then brought to what we can call the committee of the whole, which is headed by, Professor Dedino, yourself, and Professor Malami, and all the leadership think about it, assess it, and then pass back to that subcommittee for implementation, as the case may be. Now that is at expertise level. But then we also understand that Nigeria is very dynamic. Nigeria is diverse. Okay, we speak different languages. And just as Chief Mrs. Makojola said, we want to meet people where they are. And meeting people where they are require that understanding their culture, understanding their language, understanding their way of life. And to achieve that, the TWG has been structured structured in a way that Nigeria is also managed within our geopolitical zone, which means we have the sixth geopolitical zone, and then we have Abuja being, on its own, as it were. And so doing that helps us to really understand what goes on at the grassroots level, so that Dr. Uche does not just sit in Abuja and begins to understand and explain what is going on in Adodo, things like that, or in Ibuora. We want to take this thing close to the people, and because of that, the zonal structure has also been created. So as I conclude, we have two types of subgroups. We have the subcommittee addressing the technicality, and then we have the regional addressing the cultural aspect of it. Thank you, sir.
Yeah. Thank you so much, Professor Rotimi. We are looking at the time, and I think you have really succinctly answered numerous questions that we have. Now, Professor Emeritus Ifeoma Okoye, I think Professor Rotimi has laid out some of the things that goes into the one questions that I want to ask you. What are some of the unique cancer control challenges that are faced across the different regions of Nigeria? And how are you addressing those?
Okay, like you said, Professor Rotimi has dipped in a bit into literally every aspect of what are the uniqueness of these geopolitical zones. And the geopolitical zone structure actually was created because effective cancer control cannot be driven solely from Abuja. And Nigeria being large, being diverse, each region has its own healthcare realities. And for instance, cervical cancer appears to, top the list in female cancers in the northern region because of early marriages. Okay, and so there's a lot of cultural biases. For instance, there are certain workforce of healthcare workforce that cannot be permitted to have access to the females in certain parts of Nigeria. So the uniqueness, the cultural nuances, the idiosyncrasies of the different regions have to be literally handled uniquely. And the best way to do that is to have people who are aligned to those cultural practices, like Professor Rotimi is in his own region where he's comfortable, where he knows the culture of the people. And I'm in the Southeast where I was born and bred and have operated for over 45 years as a healthcare provider. And I've been, opportune to literally go into the hinterlands during the August meeting, sensitizing women, faith-based organizations. So I am fully familiar with the terrain, the cultural practices of the people, what is acceptable, what is not acceptable. And I believe that this is the whole essence of having the 6 geopolitical zones, having liaisons that would actually adopt other stakeholders to work hand in hand with them to ensure that those aspects are taken care of, even as we are trying to implement a uniform national cancer control program across board, across the nation. So taking into consideration the uniqueness of each of the regions, we'll be able to integrate and be able to bring local content to how we are able to create awareness, how we are able to engage with the people and convince them to change their health-seeking behavior. Because for each region, they have unique health-seeking behavior. For instance, in the Southeast, the men have very poor health-seeking behavior. And so they are literally unaware of the issue of prostate cancer, and they wake up to late diagnosis. And they think, cancer is a female issue. So knowing that, we know how we are going to structure and prioritize our implementation so that we'll be able to hit all those gaps that are unique to the zones. And I believe that's what all the liaisons are going to be doing across board.
Great, thank you, Professor Ifeoma Okoye. Dr. Uche, do you have one more question for them? Maybe one question, and they can each answer in about 1 minute less. You are muted, Dr. Uche.
Yes, so I have one question for each of them. So for Emeritus Professor, since she's already on the stage, Prof, please can you share with us how you think how the zones can ensure the implementation reaches communities and states?
I believe that we need to actually look at existing infrastructure that has already been set and leverage them. For instance, the primary healthcare structure in Nigeria is actually very good, down to not just local government areas, but to what they call the different communities within the local government area. And so if we leverage the primary healthcare structure, as well as some of the other structures that are available, uniquely available in Nigeria, like the National Youth Service Corps, which we have as an NGO actually templated. We have a BWS CDS in the NYSC, and you can imagine 774 local governments have, members distributed there, and they are armed with, training which are quite mundanely, understandable by the communities. So the opportunities are enormous. We want to know not only how many awareness events was conducted, but how many people were screened, how many completed referrals, how many were diagnosed early, and how many received treatment. And that way we'll be able to create and mobilize a lot of data that will be germane to that region. The opportunities are enormous. Cancer control is far too important to be left to government alone. So our intention in terms of mobilization to get to the grassroots is to also engage with high net worth individuals, opinion molders in the communities. So faith-based organization leaders, civil society leaders, traditional leaders, engage them, mobilize them to understand what the action is about and how it's going to be beneficial to the communities. And once we have them on board, the people listen to them. And so some of those things that, hindrances that we had with implementation of vaccination across the country, we will not be having it, because with that help of having all the geopolitical zones mobilized and focused on their own geopolitical zone, and mobilizing opinion leaders and policymakers and gatekeepers of the community, you'll be able to have the people listening to what needs to be done in terms of early detection, in terms of proper navigation, because after early detection, you find people begin to navigate them to the wrong places. So proper navigation to where they're going to receive the right care, and therefore reduce late detection and reduce mortality and morbidity. Thank you.
Thank you so much, Professor Rotimi. Anything to add in 1 minute or less?
Oh, sure. Thank you very much. Yeah. Just to add to what Emeritus Professor said, that's the one phase. The other phase is, where can community go to as authoritative source of information? That is another thing that we're turning the TWG to be. That at every community level, at all the PHC, where is the source that they can go to centrally for Nigeria to see, if you want information about cancer, this is where you go to. That is another thing that we're achieving through this technical working group, and it's very exciting. Thank you very much, Master.
Thank you so much. You know, what we have had is that we need to recognize early that cancer control requires systems, people, partnerships, and coordination. No single institution can do this alone. Thank you so much, Professor Rotimi and Professor Emeritus Professor Okoye. Now we are going to focus on patients being at the center, and we will be bringing in pharmacist Oduniyi and Mr. Olise. Okay, great. So thank you so much, Pharmacist Oduniyi and Mr. Olise. Pharmacist Oduniyi, do you want to go ahead and introduce yourself first?
Thank you. Good evening, my dynamic chair. Good evening, Dr. Uche. Good evening, Mr. Olise. It's a pleasure being here. Good evening, everyone, from wherever you're watching. It's nice to be here. My name is Fumi Oduniyi. I'm a pharmacist and a public health specialist and founder of Overflow Advisory, a UK-based social enterprise focused on health equity and system strengthening. Within the NCCP, I serve as the chair of the Social Determinants of Health Initiative and co-chair of the Partnerships, Resource Mobilization and Finance Subcommittee. So within that, my work focuses on building partnerships, looking into financing mechanisms and implementation of structures that help us to translate the NCCP, the plan, into action from strategy. Thank you so much.
Thank you so much. Mr. Olise, please
introduce yourself. Good evening, everyone. Okay, my name is Dennis Olise. I think I'm the reason why we are here.
Yes.
Because I'm a survivor. I had a prostate cancer, but thank God for early detection that saved my life. And that's why I'm here. I'm also a co-chair of the comms hub, the Media and Communications Hub. So basically, that's why I'm.
Yes, thank you so much, Mr. Olise. You definitely represent the reason that we are all here. So I will turn it over to Dr. Uwoku to ask more questions from Pharmacist Oduniyi.
Yeah, thank you so much, Pharmacist Oduniyi, for the great work you're doing in the SDOH. People who are listening to us may want to know what are social determinants of health and why do they matter in cancer care?
Thank you so much for that question. That's a question I'm really passionate about. So the social determinants of health, in a nutshell, are the everyday factors that affect whether someone can access care and complete care. They are non-medical things such as transport, food, housing, income, education, and family support. So cancer treatment happens in the hospital, but the care happens everywhere. Imagine a woman or a man, let's say a mother, who has breast cancer and has to have treatment. She lives in a village, but she has to go to the main hospital. She has to travel there. She's had to leave her day job. She has to think of who looks after the children, who cooks for her husband. And those factors may be the difference between actually going to have treatment or not. So those are critical factors that really make treatment happen. Thank you so much.
Thank you so much. I don't know if you can just briefly also share with us how can individuals, organizations, and companies contribute to the SDOH initiative?
Oh, thank you for asking that. So the SDOH initiative is actually something that really underpins the work we're doing at the NCCP, because without these factors being addressed, particularly in Nigeria, Nigeria has unique situation. We have such a large country, and at the end of the day, traveling is critical. People pay for quite a lot of things. Imagine people not paying just for medicines, tests, and treatment, but they have to pay for getting there, accommodation, and all those things. So what we've done here is actually rely on a lot of funding and support with the SDOH initiative. We're hoping that people can support us by partnering with us. We can actually fund what we're doing. We have, I hope we can share the actual links. We have links where people can actually contribute. We have different ways that people can contribute. It might just simply be paying into our fund. It might be partnering because you have something to offer us, and there's a lot that you can do. Within the partnerships, we have the structures in place to support whoever is willing to help. But what we need is a lot of funding so that we can facilitate all these non-medical factors that really make or break in Nigeria. Thank you so much.
Thank you so much. Do you have any other questions, Dr. Uche, or we're good to go?
Yes, I wanted to ask Mr. Olise, but you can go ahead and ask him.
Go ahead, Dr. Uche.
All right, okay. So thank you so much, Mr. Olise. I'm happy that you are not just a survivor sitting back, you're a survivor with a war chest coming out to support so that other people can also survive the disease like you.
Yes.
So I want to ask you, why is it important for cancer survivors to have a seat at the table of cancer control planning?
I'm just a case study. You understand? I bring in a lived experience because I've gone through a journey. And even now, as we are still discussing, I'm going through a journey. Cancer treatment and it's a journey in itself. So we want to bring in for people to understand, the physical and the financial implications. Statistics alone cannot do this. It is through lived experience. You share your experience, you share your journey, right from detection to treatment to aftercare. There are different experiences altogether. So having a cancer survivor will have to share this experience with the stakeholders and possibly contribute into formulating the programs and the implementation or execution of those programs, because it's actually meant for the survivor or cancer patient. It's a whole spectrum. So if the person that have experienced it is there, I'm sure you get first-hand information, first-hand details about the care and the whole system.
Thank you so much. Over to you, Prof.
Yeah, so thank you so much, Mr. Olise. I mean, that is so well said in everything that you have mentioned. So I guess the question that I have is, how are survivor champions helping to shape the NCCP implementation?
Sorry?
How are survivor champions helping to shape the NCCP implementation, Mr. Olise,
Okay.
from your perspective?
Okay. Can you hear me?
Yes, we can hear you.
Okay. I think survival champions are basically there to raise awareness of the burden, and they are there to. A very serious issue is stigma. Many cancer patients or somebody that's undergoing cancer, they have this kind of a stigma. So if you have champions, survivors that are coming out to say, look, I've gone through this. This is the situation. I think it will bring more confidence for more people to come out. And we are here to encourage screening and early detection. Just like my case, I've never shied away to actually tell people, I'm a survivor. I've gone through this. I thank God for early detection. So we, just I said about lived experience, we bring in the experience, we bring in the what's the word now? The real deal of this cancer burden. And also, we are the voices of patients. Mrs. Oduni just said something about this is a social determinant of health. In fact, it is a real challenge for cancer patients. Cost of medications are very high. And most of them are even imported, so we can't even get any local ones. So getting your drugs, me for instance, I even after this surgery, I still get medications or spend about 400 to 500,000 on a monthly basis for medications. So you can imagine if you want to go to hospital, if you don't have transport, you stay back,
Hmm.
and the disease is not waiting for you. It continues to cause havoc. But
Hmm.
if you have all those encouragement, it will help you ameliorate those things. And if you see that there's something that will help you, then another one is in participating in clinical trials.
Hmm.
You know, people don't want to come out to participate because they feel they are being used as guinea pigs.
Hmm.
But as survivor champions, we can easily convince them, and because they trust us and they know that we are in the same journey together. So we bring in those things to this. Of course, we tell our stories to inspire others so that they too will know that somebody have been through that path, and with them together, they can always succeed. So basically, those are the things that we bring to the table. And of course, like I said before, we also help to get the right implementation, the right program for cancer patients. Thank you.
Thank you so much. On behalf of the Technical Working Group members, I just want to thank you, Mr. Olise, and all our cancer survivor champions, because you are going through a lot and you're still giving yourself freely to making sure that we have cancer control, contained in Nigeria. But before you go, before you and pharmacist Udinoye leaves, I know that Dr. Uche Chukwu has news from us from the Federal Ministry of Health Leadership. Do we have a date for our social determinants of health initiative? I know that this is you might want to do the big reveal, drum roll, and I'm sure that Pharmacist Oturi and Mr. Oluse will be all smiles after you reveal this to us.
Yes, thank you so much, Prof. Just to inform everyone that the Honorable Minister of State for Health will be officially flagging off the pilot phase of the SDOH on
Wow.
Tuesday, 16th of June
Wow.
2026 at 1 p.m. Nigerian time.
Wow.
Yeah, so, and just like I was saying
exciting.
initially, that the TWG has surpassed their timelines. So the proposal was 1st to 15th of June, and the minister just tried to make sure that it worked within that period. So, but we wanted to avoid Monday because of political activities that may affect the weekend into Monday. Otherwise, it would have been done on the 15th. But it's going to be on the 16th at 1 p.m. And they have also graciously, the minister and the permanent secretary have graciously accepted to support the funding. So not just flagging it up for us.
Hey!
Wonderful. This is great. This is good.
Yeah, so they were hoping that it's going to, I won't be able to say the amount. I think it will be better from them.
Wow. Thank
This
you
is
so
really
much.
great.
Yes.
I think we are heading somewhere.
Yeah, and the permanent secretary says that she wants to personally flag off the one for Southeast on the 22nd of June.
Wow.
Yes, in Enugu. So we're hoping that other geopolitical zones should they can go ahead and propose dates for them so that we can do within the same period. Let's see which of them will be able to also go around. Professor Rotimi, if you can hear, so maybe we'll ask with Professor Pharmacist to know when you want to do for Southwest and where you want it done. So we want to concede that to the geopolitical zones to decide where the city they want it done and the dates, so we can walk around those dates. But for Abuja, North Central, and Southeast, those dates have been agreed upon.
Thank you so much. You can see the white smiles on Pharmacist Oduni and Mr. Olise.
This is really very good.
Okay.
This is good.
Look at them smiling.
This is good news.
At the center of everything we do are the people. Cancer is not a disease. It affects families, livelihoods, communities, and future so much. Thank you so much, Pharmacist Oduni and Mr. Olise. We are now going to bring in Dr. Nwamaka Lashebikan.
Thank you.
Thank you.
Dr. Lashebikan, are you in? Okay. Okay, Dr. Lashebikan, welcome. I know you are really from a very exciting time with the work that you're doing, but please introduce yourself to us first, and then I'll pass it over to Dr. Uche to ask you the questions, the tough questions for you.
Thank you so much, Evu. Very dynamic chair, Professor Dedino. Thank you, Dr. Uche. My name is Amaka Lashebikan. I'm a clinical oncologist by training. I'm a researcher and cancer control advocate. And my strong interest is in building sustainable systems for cancer control in Nigeria. So within the TWG, I serve as the chair of the Workforce Development Subcommittee within the TWG. And my role here is essentially to help us think through about not only how many professionals Nigeria needs to support the cancer care agenda, but also to try to understand the types of skills that we need and we have. So the types of skills that are needed, where these skills are domiciled, how we train people, how we retain them, because we all know about the JACA syndrome that is currently ongoing, and how we create a system where young people can grow to become leaders. So for us at this workforce subcommittee, it's not just about training individuals. We're all about building a national ecosystem of competence, mentorship, accountability, and opportunities to really drive the cancer control program through the TWG of the NCCP.
Yeah, thank you, Dr. Maka. Your work is innovating. We saw what's going from the Lancet oncology, and that's a great job. So congratulations to you and to our chair. You guys are doing an amazing job, and we are very proud of you. So we can't appreciate you enough. Yeah, so I have two questions for you. I don't know whether you can combine it or take one after the other. So one is, why is workforce development one of the most critical pillars of NCCP. And you tell us what are the biggest workforce challenges currently facing cancer care in Nigeria.
Yeah, thank you very much, Dr. Uche. And I think as we've gone through the conversations, I mean, it's clear to everybody that we need people to drive the implementation that we see. From the opening sentences when you talked about the need to get the right people in the room to drive the implementation, to the liaison officers who talked about implementation and driving community engagement. So across the entire cancer care continuum, we need people to drive it. We have the NCCP as a policy document, but it will just remain as such unless we have the right people at the right place with the right skills to actually turn all of those policy statements into actual outcomes that ultimately affect people, like we saw with Mr. Olise. So I think the workforce unit is actually the living infrastructure that is needed to support cancer control efforts in Nigeria and indeed everywhere else. And I think the next question you asked is, what are the biggest challenges we see with the workforce in Nigeria? And I think I'd like to group them into 5. So first of all is the absolute shortage of workforce that we have in the country. I'm a clinical radiation oncologist by training. I cannot tell you for free that there are just about 100 of us or less, just approximately. Now, put that aside to the data that is being touted there with over 127,000. You can see the stark disparity that already exists with that. So there's an absolute shortage, not just for the physicians, but even the skilled community health workers at the grassroots level who will improve awareness and ultimately health-seeking behaviors of the people. So across board, we don't have enough. Now, added to the fact that we don't have enough, then we are also suffering from what we call maldistribution, huge geographic disparities where people are usually around tertiary facilities and urban centers. And we know that cancer doesn't really look at where you live to affect someone. So we have people coming all the way from the rural settings who need to travel long distances. So there's lots of delays, like Mr. Olisa talked about, transportation costs that need to be borne before people can actually access care from the right people with the right skills. So there's maldistribution that is a major challenge for us. And then, of course, we talk about the skills and the competencies that exist. We can do better, and we don't even have a way of actually knowing what we have and understanding it. So that brings me to the next one, that is around workforce intelligence. And this is one area that our subcommittee is really trying to focus on, to try to map out the workforce that is available in the country, understand the geographical distribution of this workforce, the skills and the competencies that they each have, and then we understand the gaps so that as a nation, we can begin to plan for it, not in an ad hoc manner, but in a really sustainable way. And then, of course, we have the issue of retention with the JAPA syndrome. So we need to think about innovative ways to really keep our people there. A recent study, which was also in the Lancet Oncology report that just came out, highlighted this Nigeria as a case study where out of 400 respondents, 80% of the people there said they were leaving the country. And out of the 80% that said they were leaving the country, 50% of them said they weren't coming back. So you see that retention is a huge problem that we really need to sit down and think about how we keep our people down. And I think this also is a burning issue because, as we all know, in the last 2 years or so, the federal government increased by 100% for medical personnel, and I think about 400 or 500% for the nurses. So we are now going to begin to train more. Are we going to lose them? So these are some of the things at the TWG, at our subcommittee level, that we are looking at to see how can we close all these leaky pipes, how can we consolidate and make sure that we have a skilled workforce that is able to deliver on the NCC mandate of improving cancer outcomes for Nigeria by 2030.
Yeah, if you don't mind, I want to jump in and ask a quick question, Dr. Lashe-Bikon. If you can answer this in 30 seconds or less because of the time. But how is the NCCP planning to strengthen the oncology workforce pipeline? What exactly is your subcommittee planning to do, at least for the rest of the year?
So for the rest of the year, like I mentioned, the first thing we're going to do is a mapping to build the workforce intelligence that will drive us later on. A second thing we're going to do is, because we know that we need to start thinking about a sustainability plan. And so we're thinking about how to roll out capacity development for the early stage investigators, because they are the future. So we need to bring them in together, equip them with the requisite skills so that the ESIs that are currently working within the TWG are equipped with skills that will allow them to understand what is going on at a really level, to help them to also generate local evidence that we can use to plan, to help them in writing policy documents. Because many times as researchers and clinicians, we are so into publication, manuscript writing, but we don't have the time to translate it into evidence and substance that Dr. Uche and the rest of the people in the policy level can understand. So these are the things that we're thinking about doing within the next quarter to really build capacity of early stage investigations, develop mentorship camps, and then again, like I said, because the federal government has increased the training capacity, we really want to be intentional about getting these young graduates or young scholars into the oncology field so that we don't lose them.
Thank you so much, our Lancet Oncology Commissioner, Dr. Latifika, and congratulations on your Lancet Oncology report. Before we bring everybody back on the last question, I actually want to invite Engineer Bolade to make a reveal for us. So, Engineer Bolade, do you want to come on? Thanks, Dr. Latifika. Thank you so much, Engineer Akole. So great to see you. We are a little bit primed on time, but we're going to stay behind. So in about 2 minutes, we have another surprise. So we have done the surprise of the social determinants of health initiative that's going to be launched this month, but then you want to tell us something that is about to be launched today? Go ahead, Doctor. Go ahead, Engineer Akole. I don't think we can hear you. We cannot hear you. Okay, try again. Can you say something and let's see whether we can hear you this time? Okay, we cannot hear you. So while we are working on fixing your audio, can we bring back everybody else? And we will do the reveal in a few minutes, but let's bring back everybody else, please. Okay, great. We have our dynamic group. This is some of our leaders. Welcome back to the lightning round, and then we are going to take questions that are in the chat. So the lightning round is in one sentence. I know we have a lot. I know we want to say a lot about our subcommittees. We want to say a lot about geopolitical zone. We want to say a lot about our integration hubs. And I know we want to say a lot about social determinants of health, but we're going to keep it to time. So this is one sentence, not one long sentence that you're going to be out of breath. Very short sentence. In one sentence, what would you like Nigerians to know about the NCCP? We are going to start with our chief. It does not come easily to become a chief. So I'm working towards that. So we're going to start with Chief Makodiola. In one sentence, what would you like Nigerians to know about the NCCP?
Thank you very much. What I'd like Nigerians to know is that it's a collective responsibility and everybody has a role to play going on with NCCP.
Wow. Everybody has a role to play. Mr. Olise.
Yeah, in one sentence, that NCCP is building a future where fewer Nigerians will die from cancer.
Okay, awesome. I don't know how I'm going to top this. Pharmacist Odunniyi, one sentence.
What I'd like to say is that the NCCP is building something sustainable and realistic, such that every patient, every cancer patient has a successful outcome. Thank you.
Okay, woo. Powerful statements. Dr. Lashebiko.
What I'd like Nigerians to know is that the NCCP is not just a government document, it is a national commitment, and so they should hold everyone in the TWG accountable. By 2030, we must see a change in where we are now. Thank you.
Woo, that's scaring me. They should hold all of us accountable. Yes. Agree. Professor Emeritus Professor Okoye.
Okay, my own sentence is that a cancer-free Nigeria 2030 is the goal of the NCCP. And it's a Nigeria where fewer people develop preventable cancers, more cancers are detected early, and quality treatment is accessible regardless of location or income. And cancer no longer condemns families to unnecessary suffering or financial ruin.
Powerful sentence. Professor Rotimi.
Yeah. Thank you very much, everyone. I want everybody to know that NCCP is futuristic. What WHO just approved last week, we already have it in the NCCP, which is precision health. It's part of the integral pillar of NCCP. And so think about that, the amount of thought that went into this. And so the NCCP is a living document and is futuristic and is here to serve Nigerians. Thank you.
Amen to that. Dr. Nwoku, one sentence.
I want to say that I'm actually excited with the crop of experts we have in the TWG, which reassures us that a cancer-free Nigeria is possible.
That is great. For me, it is not about the federal government, it is about us. We are the us, and we can do this, and we will do this. Okay. So now I'm not sure whether engineer and colleague can come back, but we will take some questions. So please stay where you are, and let's take some questions. I'm going to attempt to find the questions, or if if our technical people can find the questions, please put the questions on, because there's a lot of comments here for us. Okay, let me see whether I can find the questions. Oh, great. What is the plan to make genetic testing available to Nigerians? I think Professor Rotimi, this question is calling you.
Yeah, thank you. So it's part of I think it's actually part of the pillar 1 of the NCCP. There are 3 sub-modules there that really address genetic testing, including cascade testing and familial, cancer testing. And it's not just integrated as part of the treatment, but particularly as part of the prevention plan for cancer in the community. Yes. So as I said, it's really part of it, and it's genetic test part of what we refer to as precision, care. So that's part of the plan. And as Dr. Uwoku said at the beginning, there's actually fund costing attached to it. And so we're fully aware of the importance of this in controlling cancer, particularly in represented communities as regions as in genomic research. So we're not oblivious to that, and that's part of this NCCP plan. So that's a great question. Thank you.
Thank you. Next question. How far have we been able to get cytotoxic drugs clinically trial tested or done based on African-based genetics makeup? Do we still depend on drugs testing of the Oyibo race? It's going to go back to Professor Rotimi. I'm glad you're here.
Yes.
And then we're going to have Professor Okoye answer the part of the clinical trials. Well, but first of all, let's do the genetic African-based genetics makeup with Professor Rotimi, and then our emeritus professor is going to talk about the clinical trials. Professor Rotimi. Okay, Professor.
Okay, can you hear me very well, ma'am?
Yes, we can hear you now.
Yes, again, I'll piggyback on the answer to the first one. Based, the question is based on our genetics. We still do not even fully know so much about our genetics. So my answer to the first question answered that aspect. We need to do more of the discovery, the science, and so NCCP recognizes this, and one of the subcommittees actually is on research. Busaya, if you can hear me, somebody's disturbing us calling this, and I don't think that this is a good time. Okay, somebody's calling the subcommittee. I think they're trying to get people to join. And it's disturbing me. Okay.
They want the subcommittee to keep working. That's your job.
Yes. So that is that aspect. So we must first of all know so much about ourselves before we begin to then strengthen the discovery and all of that, because otherwise whatever discovery that we make, we'll still be making it against a wrong reference, as you called the Oyibo race. Then the other aspect of it is that there is a subcommittee on clinical trial, and I will pass that on to Professor Okoye. So we're very also heavy on clinical trial, and thank you for this question. So I will leave it up for Professor Okoye at this level.
Professor Okoye, you go first, and then I would actually like to hear Dr. Lashebi can talk from the clinical patient-facing side as well on this question. So, Professor Okoye, go ahead.
Okay. The innovative hub, the clinical trial innovative hub, has huge plans, both to expand the involvement of Nigeria in oncology clinical trials, as well as to interrogate further what the number of low-hanging fruits candidates that are being investigated in the bench, and be able to pass them through the clinical trial process and take them to the bedside. I think this is the best thing we can do for our people, because at this moment, there are a lot of local natural products. I know that, for instance, at our center, there are oncology patients who would need blood transfusion, and they can't afford it. So they use a particular herbal product. It's actually a natural plant. And they use it, and it brings up their blood level. I think those natural products development is very, very important. And so we have a two-pronged innovation plan for the clinical trial, increased engagement and involvement in global clinical trials in oncology, as well as ensuring that we develop the capacity to assist bench scientists to look at the low-hanging candidates and take them through the clinical trial process to the bedside. That is what I think should be our strategy.
Thank you so much, Professor Okoye. While we are getting on to the next question, Dr. Lashebi, can you talk a little bit about what your subcommittee might be doing in prepping people to be able to do the trials and the research and things like that?
Yeah, thank you very much. And I think that's a really great question, and by whoever asked it, because I will talk about the workforce, and I also share experiences from a clinician point of view. As the world is advancing and moving towards precision oncology, like Professor Rotimi said, that was a directive from the World Health Assembly just last month. But even in the clinics, we are not getting, sometimes we don't get the results that we expect, and we think that, of course, that's because maybe our genetic profile is different. Now, there's a clinical trial unit, and our unit, our subcommittee is tasked with trying to support making sure that people are equipped and properly skilled to be able to carry that out. So from a subcommittee level, we are already thinking about how we can power first of all, map them out, the skill sets that are available at the hospital level to ensure that attracted, we are able to right thing. So from our own TWG level, what we are trying to do is we plan to be able to equip them with the requisite skills to ensure that once the clinical trials are attracted, there will be no GCP, all the other things that are required to make sure that we do it and we do it right. Sorry, I think my network was cutting out a bit.
No, you are quite clear. Thank you so much. Dr. Woku, is there anything that you can say to that question from the ministry point of view?
Yeah, thank you so much. The person asked what we are doing about clinical trial on cytotoxic drugs. Of course, prior to now, as a country, we had limitations in hosting clinical trials. So that means most of the drugs currently available couldn't have been tested in Nigeria because of some of the challenges we have as a country. But right now, we are partnering with the Mayo Clinic under the leadership of our chair to begin to look at our clinical trial readiness, such that further drug developments will begin to be tested in the blacks, and especially, of course, in Nigeria. So we will not blame those who couldn't conduct those trials in Nigeria because we were not ready. I must be realistic. But now our readiness is getting to a level where we can't be ignored anymore. So hopefully going forward, and of course, with what this plan has been able to itemize, where genetics is now a critical component of our national plan. So we'll begin to look at, to even understand whether our genetic makeup, is it the same, exactly the same with the Uyibos as you described it, or is it different? So that the drug that we begin to use has to now have our own smell, have our own genetic makeup addressed. So going forward as a country, the Honourable Minister has approved that, and we're already working on that. I think the TWG is taking steps to take up that now as part of our work. Thank you.
Thank you so much, Dr. Woko. I think I'm going to, I'm not sure what is going on. Okay, great. I'm going to most probably go to Chief Makonjola to also talk a little bit about that question on how can media and communications really push us forward with respect to clinical trials, because this is a huge area for us. And while while I invite Chief Makonjola, I want Pharmacist Oduniyi to get ready on what will the partnership and mobilization committee do to really get us ready for really enhancing clinical trials in Nigeria. Chief Makonjola, please go ahead.
Thank you so very much, Chair, and good evening all over again. I think I did say this at the very beginning, that media is an imperative and a strategic tool to first to disseminate awareness around clinical trials. I know that I have worked with that with Professor Okoye very, very long time back, but we need now to reactivate that awareness for people to come on clinical trials. And again, I think Dr. Uche made something that is very germane, and that's what people have always asked, that when are we going to start addressing the peculiarities of our needs, of our medical needs? And I think this is where we are. Well, now that there's a policy on ground that would also build trust and build capacity for people to be able to join the clinical trial hub. I think once awareness is created, the mistrust that had existed before now would be cleared, and the right messaging and the right tools and the hub of the media cell we have against cancer would also help to disseminate this. So we need to build capacity going forward, and we need to start using Nigerian languages to disseminate these important messages concerning cancer control. Thank you.
Thank you so much, and thank you so much, Makojola, for your leadership. Pharmacists Oduni, partners, partners, partners. We need partners.
Thank you, Prof. Certainly, we do need partners, and partnerships are a key part of a successful NCCP. Recent document we all read about success looked at that, and I believe very strongly that the NCCP, Nigerian NCCP plan is really well placed. We have global partnerships that we're looking at. We have partnerships with individuals, not just even patients. We already saw, and former patients. We have partnerships with academics. We have partnerships with so many people, and we are inviting more partnerships. We're structuring this to ensure that we have the right structure to make sure that we do have a well-balanced set of partners. In terms of clinical trials, certainly experts in the area, funding, people who would support us with funding. We need partners who would ensure that beyond Nigeria, they know that actually things like genetics, they're global. We have people who are already in developed countries with results that we can actually, be able to have shared agreements to look at what's really going on, what subtypes of cancer do we have. So there's a lot that we can do beyond simply funding. And I'm really looking forward to any form of partnerships, because really that is one of the key factors that will make us succeed. Thank you.
Thank you so much, Pharmacist Oduni. I'm not sure whether Mr. Olise can talk, but if you can, I know you mentioned this very briefly about the role that cancer champions can play in being able to really talk about clinical trials. So do you have just in 1 minute or less, any other comments on clinical trials that you want to share? Mr. Olise. Okay, so I'm not sure whether is still able to chat at this point in time, which is great. So thank you everybody for holding on. We just have a few more minutes. We still want to reveal a surprise. So Engineer Conley, can you talk now?
Yes, thank you very much. Can you hear me now?
Yes, we can hear you.
Yeah, thank you very much. It's a great honor to be on this platform this evening. That's in Nigeria. And we are glad to say that we want to launch this evening a one-stop cancer information center, which is the nccp.ng website, a one digital gateway for cancer information, resources, and collaboration in Nigeria. And I'll be showcasing that sharing the screen right now.
Okay,
so
we can't wait.
I hope you can see my screen.
It's not coming up yet.
Oh, you can't see my screen?
Okay, now it's coming up. We can see it now. Go ahead.
Okay, yeah, this is nccp.ng, a one-stop cancer information center where we can find everything about our cancer control planning in Nigeria. And it's a robust platform. We can see all the menu, the leadership, the cancer in Nigeria, strategic pillars, patients and family, and the various resources that will be made available for this objective that the nation is driving. Thank you very much. So by the special grace of God, 12 midnight this site we go live.
Wow.
Thank you very much.
Thank you so much.
Wow.
Okay, thank you so much, Engineer Colleague. I know you've been working around the clock, and we know that there is going to be most probably, maybe within the next 1 week or 2 weeks, you and Pharmacist Fumi Oduni are going to have another surprise for us to launch something else. I'm not going to say what it is. But we are happy to see the website. We are happy that our social determinants of health initiative is now is going to be launched this month. So thank you so much for everyone that has been part of us. Dr. Uche Nwoku, do you want to give the remarks, and then I'll give the closing? Go ahead, Dr. Uche.
Thank you.
I just want to say a very big thank you to Madam Chair. To be honest, I don't know the right words to use to describe you, but maybe I need to go and eat apple to get the energy to describe your kind of energy. Yeah, but we pray God to continue to bless and sustain you. What you do, we are really proud of you. Um, I'm sure people will be wondering where are we raising money to do all of this. And to be honest, I don't know. Okay, so but maybe on the 16th, we'll request the honorable minister to give us maybe like few minutes for you to give him just update, give him reports, and I'm sure that the reports he will get for just 2 months will be more than the reports of any ministry in the life of this administration. To be honest, and maybe we are going to do the report in a document and give him, because I know it's going to require two hands to carry what I've done in 2 months. Thank you so much, Prof. And thank you to all the subcommittee chair and everyone and all the participants. We are really amazed at what you are doing, passionately, selflessly, with a touch of an uncommon capacity. Maybe very soon, I don't know when we're going to have an in-person meeting. I want to meet Professor Oduni in person. Yes, because
Thank you.
yeah, it's been quite enormous what people are doing. Those who are in the seventh generation are still very stronger than some of us who are still there, Professor Koye and Chief Oji. I mean, your energy, only God can keep sustaining you at this level. I mean, it's, we're really proud of you. And then the workforce guru and my own Professor Rotimi, thank you so much, Mr. Desai. And everyone at the background listening to us, all the Nigerians, all the diasporas who are listening to us, we're really grateful. We'll try not to disappoint you. We'll keep doing our bit to ensure that all your efforts bear the desired fruits. I'm very optimistic that 50% reduction in our cancer burden is possible. Thank you so much, everyone.
Thank you so much, Dr. Uche, the hardest working cancer coordinator officer that I have ever met. And I've been working in Nigeria for a long time. Thank you for your passion. Thank you for your leadership. Thank you to the Federal Ministry of Health leadership, the minister, the honorable minister, and the PAMSTEC. The TWG membership, they just have been really outstanding. The National Cancer Control Plan is more than a document. It is a movement to prevent cancer, detect cancer earlier, improve treatment, support survivors, strengthen research, reduce disparities, and save lives. That is what we want to do. This is just the beginning. Please note that we are live every Thursday at the same time. You don't have to do anything. You just have to tune in, and we are live every Thursday at 7 p.m. WAT, 2 p.m. Eastern Time. So through June, we will continue a series. In July, we will officially launch the Thursdays live programming, but we have started our live programming. Please do not forget, thank you all for those who have subscribed to our YouTube channel. You are on there now. Subscribe. It does not cost you anything. Follow NCCP activities, join our future sections, share our contacts, post it on LinkedIn. Is all yours. This belongs to the public. It belongs to the public. It's all yours. Take the materials and share it very widely. Support our social determinants of health initiative, and please, every one of us, let us be ambassadors for a cancer-free Nigeria. Thank you for spending your evening with us. Thank you so much, everybody. Thank you to our panelists. Have a blessed day, and we thank God for the continuous blessings and energy and for magnifying all our efforts. Have a great evening, everyone.
Thank you.
We forgot to thank Busayo and Beams. Busayo and Beams, thanks for all your
Thank you, Busayo.
us on there. Thank you so much.
Thank you.
Have a blessed evening, everybody. Thanks.
Thank
Bye.
you.
Bye.
Bye,
Thank
everyone.
you.
Bye.